Okay, so here we have the most superficial layer of the female pelvic floor, and so that's the layer closest to the skin. We have our external anal sphincter. That's what's going to help hold in your waist coming from your rectum. And then we have our bulbocavernosus and our ischiocavernosus, and those two muscles are going to help with maintaining erection. So for the females, it would be with the clitoris, which is going to be up here. The next layer, which is the green, is going to be our superficial transverse perineum and our deep transverse perineum. Superficial is actually going to be a little bit closer to the skin, and the deep is going to be on top. I'll extend backwards a little further to help support that external anal sphincter. We have our compressor urethra here, and so that's going to help hold in urine coming from the bladder through the urethra right there. And then our urethrovaginal sphincter is going to come around both that urethra and the vagina coming from our uterus. And so those are going to help hold in that urine as well as closure for both the vagina and the urethra. And so our next layer includes our levator ani. Okay, so levator ani is the puborectalis coming around that rectum, creating a hole for the rectum to pass through. Pubococcygeus, which kind of blends into those muscle fibers of the puborectalis, connects up to your tailbone or your coccyx there. And then additionally, the iliococcygeus coming out towards the side of your pelvis or your hip, and then the coccygeus is going to come towards that tailbone as well. It's an additional muscle, helps create this sling-like feature of our pelvic floor, and that's going to help us with things like holding those organs such as the rectum, the uterus, and the bladder in a proper position to maintain the urine and the waste, so nothing's coming out unless we're ready to use the bathroom. We have those organs that I can show you. So the rectum coming out here with our waist is going to connect up through the large intestines and the small intestines. It's part of our GI tract that comes all the way from the stomach where our food is coming and delivers the waste down there. And we have our uterus in front of that, which has our ovaries, our fallopian tubes, the uterus where the baby is, and then the vagina, which comes out there. And so if you're not pregnant, that egg's going to be shed right down once a month that way. We also have the bladder, which is going to come in front of there, down throughout urethra, which we talked about, holding that urine until we're ready to use the bathroom. So all these muscles functioning together to keep these in place, to also create stability of the whole abdominal cavity, which includes those abs, which are going to be in front, the back muscles, your obliques on the side, and the top is actually the diaphragm, which is one of our breathing muscles. And so if you think of a plastic bag, think of the opening of a plastic bag down here. You have the plastic bag, and so if you press as if you were squeezing your abs, lifting up something heavy, the idea is that these muscles are going to not let that bag open. They're going to create that closed, pressurized system. If these muscles are weak, that's when, if you were to be lifting something heavy and you dribble a little urine, that's when we have some issues, and we need to train those muscles to do their job a little bit better. And so that is the overall function of the female pelvic floor.